Okay, this week we're going to go over the Pathology and Laboratory chapter. If you turn to that area in your textbook, you can follow along. Looking at the introduction and just talking about the format of this area in the CPT book, it says the Path and Lab section of your CPT manual is formatted according to the type of the test that's performed, whether it might be an automated multi-channel, that's some terms that you hear this chapter, assays, and so forth. To familiarize yourself with the content of the Path and Lab section, review the subsections in the CPT manual. It will help you get a broad overview. Also make sure that you read the lecture called CPT Coding Book Notes and put the notes in where I tell you to. The second paragraph there, laboratories have built-in indicators that allow additional tests to be performed without an actual second written order from the physician. These standards are set by your medical facility and imply that maybe when a certain test is positive, it's assumed that that physician would want to go further, okay, and want further information, and so an additional test might be performed right away. For example, if a routine urinalysis is performed, a culture is performed if the test has positive bacteria. So if it comes back positive for bacteria, then we go further and do a culture so we know what type of bacteria that is, so we know that, how we can treat it, what type of medicines to give. The same thing for strep. When you go in for strep throat and they swab your throat, if it's negative, they automatically will grow it for 24 hours to see if some of that strep bacteria will grow within 24 hours. Okay. Look at the paragraph that talks about collection. Okay, this is something that's important and it's not really addressed anywhere else, only right here at the beginning of the chapter. The services in the Path and Lab section include lab tests only, so we're only billing for the test with these codes. By the way, all these codes start with an 8. They're all in 8,000 codes. The collection of the specimen is reported separately from the actual test analysis. For example, if you have a person in your lab that draws blood by means of venipuncture from the arm, and the blood sample is analyzed in that laboratory, you would report this code, and this code should be bolded. Like I said, it's not talked about anywhere else. 36415. 36415 is a venipuncture code, and it is a code that is added on anytime we do blood work. Again, look at the term. Venipuncture is the definition. So we are puncturing the vein for that blood sample. Okay, so anytime we have blood work taken and it was done by venipuncture, we can add this collection code. It's kind of hard to remember because, again, it doesn't start with an 8. All of these codes are going to start with an 8, but we do add that venipuncture code. So that's one you can go and look up and make sure you make a mental note of. If we look at organ or disease-oriented panels, this is kind of the first section here, and you can read through those paragraphs. At the second paragraph there, it talks about assigning a panel code. Every single test listed in that panel description must be performed. That's a huge sentence. Every single test, or each test listed in the panel description, must be performed. Any additional tests are then reported separately. The development of panels saves your facility from having to report every single test separately. It's often more economical, meaning it saves money for the patient if you do the panel. You cannot assign modifier 52 here, or reduce service with the panel. That's one of the notes that we made in that next lecture. So with panels, they have to have every single lab test done on that patient. So if you're looking at lab test results, and we're going to code from them, if every single one of those is done under the panel, then you can bill out the panel. Okay, it's usually more economical for the patient, just like the textbook says. I worked at a facility before that their policy was we never do panels. We never did panels except for the OB, because that was standard that we knew we were going to do that one. And I guess the reasoning my providers had for that, we never do panels, is because
they thought in most cases it would be more than what they needed, and they didn't want to do more than what they needed with the patient, or take more blood than what they needed, or perform tests that weren't necessary. It goes back to medical necessity. So organ and disease-oriented panels, need to make sure you read about those. If you turn the page, the coding shot is pretty good there. Be careful when coding multiple panels on the same day for the same patient. Sometimes several panels will include the same tests. For example, a Hep B surface antigen test is in the OB panel, and it's also in the acute hepatitis panel. So you can't bill out the OB panel and the acute hepatitis panel because of the hepatitis B surface antigen test being done. It was only done once, so you can bill it out once in a panel. The other ones would have to be listed separately out. So that's really good reading there. The exercise one there, the organ or disease-oriented panels, complete the following. If you're going to do the Hep function panel code in a patient with Hep B, serum virus, chronic, if you go to panel first in the back of your CPT book, if you go to panel first in your index, it says see blood test or organ or disease-oriented panels. So it's just something, the more you do it, the more you'll remember, how to look that up, but that's how you find those there. Drug assays are talked about next. They're performed to identify either the presence of something or the absence of something. Testing that determines the presence or absence of a drug is qualitative, okay, whether it's there or not. And then they talk about the methods and dividing them up on how they do those. Therapeutic drug assays. So we talked about regular drug assays. Now we do therapeutic drug assays. These are looking for a specific drug and the amount of it that is in the bloodstream or in our system at that time. The middle paragraph there explains why we have these done, and it says therapeutic drug assays are performed to help your physician monitor the level of medication in the patient's system or monitor the patient's compliance with their medicine. Are they telling us they're taking it every morning? But we can prove that they're not by looking, at the therapeutic drug assay. For example, levels may be measured to make certain the patient is getting correct levels of antibiotics. Blood specimens for drug monitoring are usually taken during the drug's highest therapeutic concentration, at the drug's lowest therapeutic concentration, and those levels, the peak and the trough levels, should be within that therapeutic range. A lot of times, and it addresses it here, we, as a coder, I often had a drug book beside me because of the reasons here that are listed. Drugs are listed by their generic names, not their brand names. So a lot of times we need to reference that in a drug book so we can find the generic name and then look up those codes for those. Evocative suppression testing, we get into a little bit more of those as we go into advanced coding, so there's not a lot there you need to read through. The clinical pathology, we can skip those. We will read through those in a little bit as well. The next thing we really need to look at is if you turn to the section that talks about hematology and coagulation. Hematology and coagulation subsection contains these codes, and it says 85002 to 85999. Based on the various blood drawing methods and tests, the method used to perform the test is often what determines the code assignment. A blood count is used to measure the kind and the number of cells in your blood, such as the red ones or the white ones. It's commonly used test to detect various abnormalities in your blood. The blood counts can be this or this. They can be manual or they can be automated with many different variations. That's the confusing part of this. For example, codes in the range 85004 to 85049 are blood count codes divided by method, so manual or automated again, and the type of count, such as a white blood count, or a complete blood count, and they give us the ranges for those there. So to accurately code a blood count, you need to know the method. Is it manual or automated? And the type of the count has to be documented as well. And I think this is a little bit scary as students in the Intro to CPT class when you're doing your homework for this section. But believe me, when you're out in the real world and coding labs, the results are very specific about what test was done, so you know exactly what test to code. Okay, it's kind of harder in this book. They don't simplify it as much as I wish they would. So you can read through the rest of that. The next page talks about, there's a small paragraph that talks about how to look these up. And it says most of these tests in the hematology and coagulation subsection can be located in your index under the name of the test, okay? Like prothrombin time, coagulation time, hemogram, hematocrit, okay? So you can go by the name when you're looking up in the index, which is nice. Immunology is listed there. There's not a lot that we need to talk about. One little short section there, and then an exercise that you can do. Again, remember, if you go through these exercises and check yourself in the back of the book, you know, it really, really helps the more you can do. Transfusion, we're going to skip. Really, if we go to, cytopathology and cytogenic studies, this is more common in the outpatient clinic type setting because a very common cytopath procedure is your pap smear. Okay, so that is listed there, and you can look up those codes. Surgical pathology is where we need to spend time. Surgical pathology codes describe the evaluation of a specimen. Okay, so we're looking at the pathology or the disease process. So it says when you're choosing the correct code for pathology, identify the source of the specimen and the reason for the surgical procedure. The surgical pathology subsection codes are divided by levels, okay, levels 1 through 6. And they're based on the specimen and then the level of work that's required by the pathologist. They kind of go in hierarchy, level 1 and level 2, and then it gets harder as we move up to level 6. Okay, so there's the levels there on the page for you. You can read through those. Okay, that's totally fine. It would be great if you looked them up in your CPT book as well. All of these codes start with 88. Okay, and it's surgical, again, surgical pathology. So some notes that I have written in my textbook here is I have the word gross, Gross, and I have the word micro. Okay. Gross, and the definition of gross is by my eye. Okay, just looking at it, the gross description, it looks like this, and there'll be a description. A micro is a microscopic description, meaning using the scope or using the microscope. Okay, level 1 says gross examination only. So if you are coding something from surgical pathology and you see only a paragraph that says gross description, it's automatically a level 1. Super easy. Okay. But if you see gross and micro, then you need to look through the levels here and see which one. If you look at the example in the next exercise, you can see a kind of a copy of a fake report there, a path report. And that really is good there. It really is close to what they actually look like. And you can see the gross description, and it should be a little better here, microscopic description, and then the diagnosis. They put microscopic and diagnosis together. But you need to be cautious and you need to pay attention when you're doing surgical pathology. So anytime something is taken out, if you had your tonsils removed, if you had a wart removed, if you had a funny looking mole removed, you will have surgical pathology anytime tissue is taken. Okay, so make sure you read through that section really well too, and pay really close attention to the CPT book. Okay, in the 88 codes there. Remember, all these codes start with an 8. Surgical pathology codes all start with an 88. So if you look at those, I think fallopian tube is a good example. Fallopian tube is listed in a couple of levels under surgical pathology, but it's the reasoning. Okay, remember, we need to know the specimen examined and then the level of work or the reason for that surgical procedure. So you need to be cautious. Don't just find fallopian tube, yep, that's it, and I'm done. Go through the levels and be sure that you're at the right level, because fallopian tube shows up somewhere else too, okay, for a different reason. And it's hierarchical again for a tougher or more advanced reason. So make sure you get those straight. That's pretty much it for Path and Lab. Make sure you let me know if you have any questions.